So in the next couple minutes, I'm going to give you a quick tour of the New Hope Center in Goma, where Jericho Road will be starting a medical clinic real soon. So we're entering the New Hope Center, and you will see on the right two beautiful brick buildings, one of which is used mostly as a conference center to have large group trainings with the children, sometimes trainings with staff, and sometimes even pastoral trainings. And then as you look around, right in front of us is the building that houses 5 classrooms, and in each of these classrooms they do a different type of group therapy with these children that have been traumatized by war, have been orphaned, or been affected in some other way. This center provides services to over 500 traumatized children, and mostly orphans. And then as we're walking further into the compound, you can see in the distance where our clinic will be. I will take us there. As you know, this is a partnership between Jericho Road Community Health Center and New Hope Center, along with River Rock Church, Wesleyan Church of Hamburg, and World Relief. And it's our goal that we'll be able to really, in a holistic way, provide medical care and support the New Hope Center as they provide trauma services to these vulnerable children and their families. On the right, you see some outside toilets and showers, and then right here in the middle is a basketball court. I would probably prefer a soccer court, but this is about what the room is on this in this facility. And then as we're coming forward now, in my background is the New Hope buildings, and we're coming into where the clinic will be, that we are in the process of actually building right now. So let me just give you a sense of what this looks like as we come through what will be a gate that will separate the New Hope Psychosocial Center and the clinic that we're calling the Wellness Clinic of the New Hope Center. You'll see, just quickly, I'll show you the extent of this center. I'll start here on the right. Right here is where we are hoping to build several outdoor toilets and showers for our patients to use. This shed right in front of us will be rehabbed. The structure will remain in place, but we'll put a 3-foot wall around the whole shed, brick wall, and divide it into several rooms. The shed will be able to house a training center for health education for patients, be a place where our staff can meet in the mornings for devotions. In the middle there'll be a kitchen where our patients can use to families can cook food for their loved one that is in the hospital, and then also a laundry. The families here do the laundry every day for their family member who's admitted to our center. Here in Congo, the family takes care of those kind of details. Right in front of us is a big hole that will eventually be a septic tank. They have to dig down 3 meters and go through all kinds of lava rock, and they're doing everything by hand. If they get to a rock that's especially big, they light a fire underneath it with the hope of getting it to soften up. You can see right here, this is the beginning of this is the main clinic that we are building now. You see the bricks that are being laid. They have the foundation in order. They've gotten a lot of work done this week already. Just like in Sierra Leone, this whole thing is being built without any power tools and pretty much all built by hand. Pretty amazing when you think of it. And then here on the left is a building that we'll be rehabbing. It was in the past used to house pastors and teachers who came to the center to sleep, but now we'll be turning it into an inpatient ward with 20 beds. And in the future, this ward will be connected to our clinic by a walkway so that they can easily transport patients back and forth. Then, as I'm walking around the back of our this new clinic, I'm going to show you the view from the front. As you remember, there was a gate to the center that we started with. Here will be the place where people will come into the health center, new gate, and then you can see the front of this facility. It could be a parking lot or a place where patients could wait. And then in the very front, you can see here the entrance to the health center. And on the side here, a bunch of bricks that were locally made that will be used. This will be a beautiful building that will complement what is already on this facility. And finally, in the back corner is a place that we'll be developing with gardening as a place for patients to wait. Eventually, we see this area that I'm looking at right here as being phase 2 of operations, where we can build another building that would house a surgical center and an extension of the clinic. But that will come in a few years. Let's get started first. So, in conclusion, my introduction to the Wellness Center at New Hope in Goma, Congo. Thank you, so many of you who have supported this work.